Good evening, I'm Dr. Nicole Hope. Thank you for attending tonight's webinar, and this is part of our regular monthly webinar series, Getting to the Heart of Fertility. Tonight we are talking about egg freezing. Is it right for me and what's involved? Speaking with me tonight is Dr. Amber Kennedy, who is going to bring her youthful exuberance to the presentation. And during the presentation, what I will get you to do, if you can, is submit some questions, which you can do on your screens, and we will answer those questions at the end of the presentation. So please submit some questions for us. Just starting off with a brief COVID update. We are still doing IVF. It's business as usual. Obviously, our IVF is with extra precautions. There's lots of social distancing, wearing masks. Unfortunately, for those who are coming through treatment with partners, less partners in the clinic, and for those having egg collections, there are COVID tests that have to be done before the egg collection. But there are no waiting lists to get started. We are happy for you guys to come in and see us and get pregnant. So we're not recommending to delay treatment at the moment, and we're happy to see you and look after you. On other fertility news, we are pleased to announce that our donor sperm program is officially open. So we do have donor sperm available now. We have some sperm from the European Sperm Bank, and we also have some sperm which has been from locally recruited sperm donors. We are always interested in sperm donors, and there is a big demand for sperm donors. So if you yourself are interested in donating sperm, or you know someone who's interested in donating sperm, please get them to contact us. So starting with our webinar tonight, as I mentioned, Dr. Amber Kennedy is here, and she's going to begin the presentation, and then I'm going to speak to you later on and do the second half of the presentation, and then both of us will be fielding those questions that you've sent through to us. So without further ado, here is Amber.
Hello everyone, and thanks Nicole. So as Nicole mentioned, tonight we're both going to talk to you about different aspects of egg freezing. So elective egg freezing or fertility preservation, you can think of it as a choice that some women make to increase their fertility options and increase the possibility of having a baby at some stage in the future. There is also medical fertility preservation, which may be recommended after a diagnosis of cancer prior to starting chemotherapy. Chemotherapy can threaten fertility or future fertility, and so egg freezing is an option for these patients. So tonight we are going to focus mainly on elective egg freezing. And we're going to answer the following questions that you may have. You might want to know, should I freeze my eggs? Firstly, how old are you? How many children are in your ideal family? How old will you be when you have your first child? And finally, how old will you be when you have your last child? And just ponder that last question for a moment. How old will you be when you have your last child? And you may be surprised to hear that we think if that is older than 35, you should seriously consider egg freezing. And we're going to talk through why that is. So from very early on in our reproductive lives, we are taught exactly the opposite, how not to get pregnant. And that's because the time is just often not right for a pregnancy. And everyone's right time is different. But the right time for you may not be the right time for your fertility. And when it comes to your fertility, the single biggest thing that you should consider is your age. And if for a moment we put aside all of those very important factors, like being in a safe and supported relationship, pursuance of education, being financially secure, or in a have career security, all of those very important things that women and couples need to consider when it comes to planning a family. If we put those things to the side just for a moment and purely think about fertility, when is the optimal time to have a family? So to answer that question, we can look to the results of this study, which was designed to model your chance of successfully having a family of desired size, depending on the age that you are when you start trying to create that family. So if you're wanting to have just one child, if you start at the age of 25, you have a greater than 95% chance of successfully having one child. And you can increase that to almost 100%, not quite, but almost 100% with the addition of IVF. That chance of success gradually decreases. And if we look at age 40, if you're 40 when you start, you have just a 60% chance of successfully having one child. You can increase that to about 70% with the addition of IVF. If you look now to attempting to have a two-child family, that curve is pushed to the left. And at age 25, you still have a 92% chance of success and a greater than 95% chance if you add on IVF. But at age 40, that chance of success is only 35%, and there is a slightly increased benefit of adding on IVF, but not as much as before. And if it is 3 children that you desire, at age 25, there's still an 88% chance, and with the addition of IVF, still about 95% chance of successfully having 3 children. But at age 40, that chance falls to just 15%, and there's minimal benefit to adding on IVF at that age in order to conceive a 3-child family. So when we're talking about the age of starting and the total number of children in your desired family, what we're actually talking about, how old will you be for your subsequent child? Not necessarily your first, but your second, your third, and your last child. And it is the age that you will be for your last child that has the single biggest impact on your chance of successfully having your desired family size. So next, let's think about the concept of fecundity. Fecundity is actually just a synonym for fertility, but we tend to use it when we're talking mathematically and trying to put a number on your chances of conceiving. So fecundity is defined as the probability of falling pregnant in any given month or cycle. And in young, healthy couples, averaged out over the first 3 months, it's about 25%. Over the subsequent 9 months, averaged out, it's about 15% per month. This gives you a total cumulative chance of pregnancy after 12 months of trying of about 85% or 80 to 85%. If you keep trying for a subsequent 12 months, it's then up to 90, 95%. Fecundity actually declines with each non-successful cycle, and that's demonstrated in the graph that we have here. So on the vertical axis, this has the pregnancy rate per cycle, the chance of successful pregnancy, and on the horizontal axis, the cycle number from 1 to 12. You can see that it actually starts off at about 30% chance per cycle in healthy young couples trying to conceive. And gradually that does decline with each successive cycle that is non-successful. After about 10 cycles, it's less than 10% for 10, 11, 12. We're going to come back to this graph in a moment. But first, let's talk about the effect of your age on your natural pregnancy rate or your fecundity. So the purple line shows your chance of pregnancy across different ages. As we said before, it's a 25% chance in young, healthy couples per month over the first few months of trying. And you can see that from about age 30, that does slowly start to decline to a point where in your 40s, it's actually in the low single digits. Shown by the green line, we simultaneously see a sharp rise in the risk of miscarriage if you do conceive. So at age 27, your chance of spontaneous pregnancy each month is 25%. And if you do conceive, your chance of miscarriage is 10%. Compare that to age 37, your chance of spontaneous pregnancy each month falls to 10%, and the chance of miscarriage increases to 25%. And at age 40, we see just a 2% chance of pregnancy per month and a miscarriage rate of up to 55% if you do conceive. So the take-home message from this graph is that as with increasing age, your chance of falling pregnant per month steadily declines, and at the same time, the risk of miscarriage significantly increases. So back to our graph of fecundity in healthy couples trying to conceive. So as we said before, it starts off at about 30% per cycle. And if you're 27, this is where it starts with your first cycle, and it gradually does decrease. But if you're 37, you start off way down here, down the curve at 10%. And if you're 43, you're already down here. So you begin to see why we are suggesting that if you're planning any pregnancy at an older age than 35, you should be thinking about egg freezing. So egg freezing is defined as the process for extracting eggs from your ovaries and freezing them for later use. Any egg that is frozen forever remains the age that it was at the time that it was collected. You are pressing pause on that age-related decline. Regardless of the age you will be when you return to use them. Now, this is one of the favourite graphs that I use in practice because it illustrates multiple points really nicely, and I'm going to talk you through it. Before, we talked about your natural fertility rate, which is again shown with the purple line. In the orange line, we have IVF success rates using your own fresh eggs. As you can see, by having IVF, you can significantly increase your chance of conceiving per cycle. But there is still a significant age-related decline starting at about age 35. And this is because no matter what we do in IVF, we cannot improve your egg quality. But have a look at the blue line. These are donor cycles. Donors come from women who donate, young women who donate eggs. And regardless of the age of the recipient, the success rates remain steady. And this is all to do with the age of the egg. So we would like to redefine egg freezing as choosing to have the option to donate eggs to your future self in case you need them. Because if you are planning a pregnancy at an older age, whether it be for your first, your second, your third, or your fourth child, having eggs frozen may in fact increase your chance of conceiving. Because when the time is right for you to either begin or add to your family, and you're unable to conceive naturally, if you do need fertility treatment, rather than using an egg donor, why not use the eggs that you have already in storage? So now I'm going to hand over to Nicole, who's going to tell you everything you need to know about the process of egg freezing.
Thanks, Amber. Nearly there. Okay. Chris doesn't. Sorry. Okay, so I'm going to take you through first the steps in a normal IVF cycle and the timeline. So typically we start IVF when you have a period. You usually start injections on the second day of your period, and you're often taking injections for about 10 days in total. You would then have your egg collection about 2 weeks after your period, say on around day 13. And usually if you were doing an IVF cycle, on that day, that's when we're getting the sperm and the eggs, and we're putting them together to create embryos. We then grow the embryos in the lab for 5 days, and then usually we bring you back in, and at that time we put the embryo back into you, which we call the embryo transfer. And then there's about a 1.5 week wait until you do your pregnancy test, which is at the end of the month, which around day 26, 27 of your cycle. So an egg-free cycle is exactly the same as an IVF cycle. It's just that we stop at the part where we're creating embryos. So we usually start when you have a period. We usually start the injections on day 2 of the cycle, again taking injections for around 10 days between day 2 and day 12, and then having that egg collection on around day 13. And then on that day, that's when the eggs are frozen, and that's the end of the egg freeze cycle. So it takes about 2 weeks to grow your eggs. With our medication, we can hopefully get multiple eggs to grow, but it still takes the same amount of time to grow the eggs in you as it does in a normal cycle. Typically, you'd be having 10 to 15 injections in an egg freeze cycle. Initially, you might start an injection at night, which is follicle stimulating hormone, and that's to try and get multiple eggs to grow. And then after a few days, you're going to start a second injection in the morning, and that's to make sure you don't ovulate too early. After you've been on the medications for about a week, you come in and have a blood test and scan, and we see how many follicles there are and how big they are. And we work out when's going to be the best time for the egg collection. Sometimes you might already be ready early. Sometimes we might tell you, you have to take the medications for a couple more days, come in and have another blood test and scan, and then we might make the decision at that point as to when the egg collection will be. The egg collection itself is a small operation. It is done under an anaesthetic. It's not a full general anaesthetic, but it's a sedation, so you shouldn't remember anything about the procedure. It typically takes about 20 minutes. You definitely need that day off because you've had the anaesthetic. Some women are okay to return to work the next day, but a lot of women also take the next day off as well. So this diagram is showing an actual egg collection procedure. When you've had the drugs to stimulate your ovaries, the ovaries are really large and they're very easy for us to reach through the vagina. We use an internal ultrasound, and many of you have probably already had one of those before, and we can see the ovaries and see the follicles. We then have a little needle on the end of our ultrasound, and we can push that through the vagina into the ovary to suck out the eggs. And so we do that on one side, and then we move to the ovary on the other side. So this is all done through the vagina. We don't make any cuts or incisions. You're not usually having any stitches. When you wake up, you will feel a bit tender and sore because we've been putting a needle into your ovaries, but usually we are just sending you home with some regular Panadol to take, and you may have a little bit of bleeding just because the needle has gone in and out, but generally speaking, we're expecting you to be walking out of the hospital having had the egg collection. So when you have your egg collection procedure, we already know straight away how many eggs have been collected. And before you leave after your egg collection, we will already tell you how many eggs we have collected. However, initially, we don't know how many of those eggs are mature. So we do the egg collection first, and then over the next hour or two, our embryologist will be having a look at the eggs in more detail to work out which ones are mature and which ones are immature. Unfortunately, we can't freeze the immature ones, so we only freeze the mature ones. So we will give you a call the next day to let you know how many of the eggs that were collected have been able to be frozen. The eggs are snap frozen and they can last indefinitely. We store them in liquid nitrogen tanks. They're not like your meat in the freezer that you have to throw away after 3 months. They can stay there as long as you like. So if you collect those eggs at 30 and you're not using them till 40, they will be absolutely fine. And we take very good care of them while they're in our lab. Our liquid nitrogen tanks are alarmed and they're kept at a steady temperature and the right gas concentration to make sure those eggs are in just as good a shape when we go to use them as they were when we froze them. So now what do you do later on if you want to use those frozen eggs? Well, I already took you through a normal IVF cycle and we've already done the first half in the egg freezing. So now we have to complete the second half of the cycle. So when you have the eggs collected, you're going up to that day 13 stage and having the egg collection procedure, and the eggs are frozen. And so then later on, when we go to use the frozen eggs, we do what we call a VOT cycle. So VOT stands for vitrified oocyte thaw. So vitrified is the name of the freezing technique. Oocyte means egg, and thaw means we take it out of the freezer and thaw them out. And this can be done years later. So if you are having a regular cycle, we like to thaw the eggs around on the day that you are actually ovulating. And that way we know that the eggs are in sync with what's going on inside your body. If you don't ovulate or you're not having a period, then you may be on some medications to mimic the natural ovulation cycle. So we monitor for ovulation, we thaw the eggs on that day, and we want to put the egg and sperm together on the same day, like we would do in a normal IVF cycle. When we inseminate the eggs, we always do ICSI for frozen eggs. This is because they don't tend to fertilise with regular fertilisation or what we call standard fertilisation. We do need to inject the sperm into the frozen eggs to make sure that we give them the best chance of fertilisation. We then grow them in the lab for 5 days. And then we bring you back to do the embryo transfer. And this is a procedure that's very much like a pap smear. It only takes about 5 minutes. We don't typically give an anaesthetic. However, if you are someone who does struggle with pap smears, you can request an anaesthetic and we can arrange that. If you're not having an anaesthetic, you can actually go straight back to work afterwards. You don't have to sort of lie on a bed with your legs up in the air for hours. Once the embryo is in, it's in, and we just encourage you to return to your normal activities. So after you have the embryo transfer, we are then in the hard part of the cycle, which is waiting the week and a half to do your pregnancy test. Now, we will often defrost multiple eggs at once and inject them all with sperm, and then we grow the whole batch over that 5-day period in the lab. Sometimes there may only be one embryo to put back, but sometimes there might actually be more than one good embryo. If that's the case, then what we will do is we will transfer one embryo into you, and any additional embryos, we can actually freeze them. And there is no concern with freezing an embryo if it's been created from an originally frozen egg. There's also the option to do genetic testing on embryos. So we do that when they are at that day 5 stage, and then we do need to freeze them anyway while we're waiting for results. So sometimes people might have one embryo put back fresh, and then there might be additional embryos that can be frozen and used for the next time around. So does egg freezing work? Well, the answer is it does depend on your egg quantity and egg quality. So this graph, it's got a lot going on, but what it's trying to show is the chance of having at least one live birth, so one baby from egg freezing. So on the right-hand side of the screen, that's looking at the age of the woman when she has frozen her eggs. Down the bottom is the number of eggs you need to have frozen, and on the left-hand side is the chance of having at least one baby. So I'm going to look at the top line, the blue line, and if you look to the right-hand side, you can see this is for women who are 35 years or younger, and if you have a look down the bottom, if those women have 20 eggs frozen, that gives them about a 77% chance of having at least one live birth. If those same women freeze 40 eggs, that gives them over a 95% chance of having at least one live birth. So I think this screen here is explaining what I just said. However, just going back one screen, one thing you will notice here is that unfortunately none of these lines ever get up to 100%. So we can't say to you, if you freeze this number of eggs, you will 100% have a baby, because ultimately getting pregnant is not all about the eggs, it's also about the sperm, and it's also about the environment in your uterus, and those things we can't always control. But the eggs are a big factor, and they do help us predict your chances. Sorry. If you wait until you're 37 years old to freeze eggs, so if you freeze 20 eggs, unfortunately, if you were 35 or younger, you had about a 77% chance of one baby with 20 eggs. But if you wait until you're 37, the same 20 eggs will only give you a 60% chance of having at least one live birth. And likewise, if you freeze 40 eggs, when you were 35 or younger, that gave you a 95% chance, but when you're 37, it drops down to 84%. So where possible, we do recommend to freeze eggs at the youngest possible age, and ideally before the age of 35. So quality and quantity are really important. The only way we can predict your egg quality is based on your age. And we have graphs like what I showed you before, which will help us predict how many eggs we need to collect according to your age. We can, however, do tests of your egg number, and we call this ovarian reserve screening. We can do your ovarian reserve screening in one of two ways. There is a blood test called an AMH test. AMH stands for anti-Müllerian hormone, and this is a hormone produced by all your eggs. So the more eggs you have, the higher your AMH hormone level, and the less eggs you have, the lower the AMH level. So an AMH level will give us an idea about your long-term egg supplies. The other way we can assess your ovarian reserve is with a pelvic ultrasound, and that will give us an idea about how many follicles are on each ovary in any given month and how many eggs we're likely to collect from a single egg collection cycle. So usually before you start an egg-free cycle, your fertility specialist will be able to give you an idea about how many eggs we're likely to collect from an IVF cycle for you as an individual, and therefore how many IVF cycles you need to do to give yourself the best chance of having a live birth. So it is important to know that ovarian reserve it not only varies with age, but it also varies between individuals. There are some people who do have a very high ovarian reserve, and they may be able to collect a really large number of eggs in only 1 or 2 IVF cycles, whereas someone else who has a low ovarian reserve might have to do several IVF cycles to collect the same number of eggs. So it's really important you have these things assessed before you start an egg-free cycle so that you have the right information going into it and have some realistic expectations about how many times you might need to have treatment to achieve your desired outcome. So earlier, Amber did mention that we can do egg freezing for cancer patients as well. It's a very similar process to the elective egg freezing that we've been speaking about. Often when patients have cancer, we are often pressed for time and we need to try and freeze eggs in as quick a time as we can. Unfortunately, it still takes 2 weeks to make the eggs grow, but usually rather than wait for a period, we might start the medication straight away. Sometimes some of the medications we use may be a little bit different, and sometimes if we have enough time, we might even do 2 egg freezing cycles quite close to each other to maximise the number of eggs that we can freeze before a person begins their chemotherapy. Sometimes, if there's not enough time for egg freezing, we may even discuss other options such as freezing ovarian tissue, but where possible, egg freezing is a lot more reliable and gives us a lot more predictable results. So I am at the end of our presentation today and we are now open for questions, and I think I've got the first question here. I think Amber is going to come and answer our first question, so I'm going to hand over to Amber.
Thanks, Nicole. So the first question we have is, of course, what is the optimal age to freeze my eggs? And while this does differ from patient to patient and individual circumstances do need to be taken into account, but what you need to weigh up is the quality and quantity of the eggs that you may collect during an egg collection. So obviously that will be higher at the younger ages, let's say 25, that will have the best result. But if you are 25 and you collect your eggs and freeze them, we do know that there is much less chance that you will actually need them, because the chances are you'll meet the man or the woman of your dreams and you will start your family at a younger age. So what we generally say is that if you're if you're 30 to 32, 35, and you don't have imminent plans of starting a family, then you should be thinking about egg freezing at that time. And our next question is, what about sperm freezing? Well, we freeze sperm all the time as part of IVF. That's no problems at all. Men who are facing fertility issues will have frozen sperm so that they have some in reserve prior to their partner's egg collection. So we do freeze sperm all the time. Men facing cancer treatment may want to freeze sperm prior to starting chemotherapy. We don't generally freeze sperm for men for age-related fertility decline. There is some decline in fertility related to age in the men, but it is just not the same as what we see in women. And I think Nicole has questions.
Thank you. So the question I have is, can I fertilise eggs with donor sperm, fertilise the frozen eggs? And the answer is absolutely. So I do see a lot of ladies who maybe are in their early 30s and are single, and they will freeze eggs then, and they may wait a few years to see if they do form a relationship where they want to conceive, and if they don't, then they may come back at that stage and use their frozen eggs with donor sperm. Sometimes in those women, I would, especially if they want more than one child, I might even say, why don't you try IVF using fresh eggs and the donor sperm, and keep those frozen eggs for later, for when you want a second child. So there are always different options to do things, but absolutely you can use donor sperm with your frozen eggs. The next question that I have is it better to try for a pregnancy with donor sperm or freeze eggs? And I think that really comes down to, are you prepared to be a single mum, or what's your particular situation? So some women come and see me and they say, look, I am not sure about being a mum, but I don't want to miss out on that opportunity if I meet the right person. So I will freeze eggs now, and if I do meet someone down the track then and I am older, then I have that option to use those eggs then. Some women come and see me and they will say, look, I know I want to be a mum. I've always wanted to be a mum, and if I haven't met the right person by whatever age, I'm going to do this on my own. And sometimes with those women, if potentially they're 32 and they're saying to me, oh, look, if I'm not in a relationship by 35, I'm going to come through and try and conceive with donor sperm. I might even say to them, look, maybe just hold off on freezing eggs and just come through when you're 35 with the donor sperm. So I think it really just comes down to, are you freezing the eggs just as a backup, or is this something where you really want to conceive and you'll do it as a single woman? And everyone's a bit different, and these are things to talk about with your fertility specialist. I have another question, or is Amber coming and doing a couple more questions? So we're just going to rotate. So I will wait for her to come through and answer your next questions.
Okay, thank you. So the next question that's come through from our viewers is, what is considered a high and a low ovarian reserve based on the number of follicles? Well, this is age dependent and it's a bit of a continual spectrum, but less than 12 is probably considered low. 12 to 24 is normal. Greater than 50 is what we consider PCOS range, and very high. And actually this is quite good if you're thinking about egg freezing, because you're likely to have a good response to ovarian stimulation. And the next question is, does egg freezing affect your ability to naturally conceive? So that answer is no. If you have an egg freezing cycle in your early 30s, those eggs that are collected are from a cohort of eggs that have been recruited to become mature in a cycle at that time, and it does not in any way affect your ovarian reserve or your chances of falling pregnant later in your reproductive life.
Okay, so next question is, if I have severe endometriosis, how long should I wait after my surgery to freeze eggs? Ultimately, if you do have severe endometriosis, I imagine your surgery is probably quite extensive, and just physically it might take you a month to recover completely from that surgery. But potentially there's not really a set amount of time that you should wait. And I think potentially if 6 weeks later you are feeling quite recovered from that surgery, then you could begin egg freezing as soon as that. Ultimately, you would want to speak with the doctor who's doing your surgery in case there's something particularly unusual that they want you to wait longer to recover before doing an egg freeze. But usually I would say by 6 weeks after surgery, it's reasonable to attempt an egg freeze cycle. Next question I have is, what if I am planning on having IVF for conception immediately, but I have blood tests that, let me have a look, that suggest I may not be healthy? Do I postpone and freeze eggs at the collection point instead of going ahead with it? I think if you are in a relationship and you have sperm available and you know that you want to have children, I think rather than freeze eggs, I would just encourage you to then do the IVF cycle and potentially create and freeze embryos. Ultimately, as I was saying before, when we freeze eggs, we can estimate how they will go depending on your age and the number of eggs, but we know the sperm's a big component. So if you do have sperm available, it's really helpful to put those egg and sperm together and actually see how many embryos you've got and what you actually have frozen. And that way you'll also know down the track if you need to do further treatment cycles. But I think if you've got a current health problem during your IVF cycle, it's best to speak to your fertility specialist to see whether they think you can have a fresh transfer or whether you do need to freeze embryos. The next question is, does egg freezing push forward my menopause? And Amber touched base on this just a minute ago. When you have an egg freeze cycle, there are a certain number of eggs available in that month for us to collect. If we do not collect those eggs are dying and they're gone. So what we are actually doing in an egg freeze cycle is saving eggs that are there. So whether we take them out in the lab and freeze them, or whether you just let them go away naturally, those eggs that we take out are not going to be there next month. So we are not making you run out of eggs earlier. We are just saving eggs that otherwise would have naturally been lost over the course of that particular month. So I think we have done with all the questions now, and thank you for submitting them. They were really great questions. We did enjoy having you as our virtual guest tonight, and we hope that you enjoyed this webinar. We have another webinar planned next month. It's the 13th of October, which is a Tuesday night, and the topic is what fertility treatment options are available for lesbian couples who want to have a baby. And that's with Dr. Samir Jatkar and Dr. Chris Russell. You'll be automatically registered for the next webinar, and you'll get a reminder in your inbox. Just a reminder that all the previous webinars and future webinars will be uploaded onto YouTube channel, and you just need to search YouTube for Newlife IVF Australia to find all the previous presentations that we've done. As always, if we can be of any assistance on your fertility journey, please contact Newlife IVF, and our wonderful staff will take excellent care of you. Our number at the clinic is 808933, or you can email us at hello@newlifeivf.com.au, or you can just visit our website newlifeivf.com.au, and the phone number and the email address are on that as well. So thank you once again for attending tonight's webinar, and we hope you enjoy the rest of the evening. I am not rushing home to watch Plate of Origin, but I will go and get my own dinner, which hopefully my husband has cooked for me. So have a great night, and we'll catch up soon.